mental health support would you like to see in schools that doesn't exist already? And we heard about this a little bit earlier. What changes would you make in school if you were, a school principal or, a school inspector, to kind of encourage either more support or making it easier for students to access the support that there is?
I think it would be really helpful to have mental health education system in school for those who are dealing with long-term mental health issues or need to miss school due to specific stressful events. This kind of system will allow them to take a break and recover emotionally and return to school more smoothly. Of course, there would be clear guidelines to prevent misuse, but overall, I believe it could make school life much healthier and more sustainable for many students.
That's incredible. I've never heard that suggestion before. That's a wonderful idea. So, if I've understood that correctly, that's like in a job you take sick leave, take sick leave for your mental health. It's something I've done in the past, and it's kind of recognised and it's normal, and there's a policy, and it's a nice name for it, and it's not hidden away. Is that what you're describing? Like a clear. What a wonderful idea. Do schools do that in Korea, or is it something you've come up with as an idea?
In Korean local school, there isn't any mental health educations, but I just hope.
It's a wonderful idea. Okay, great. What do other people think?
I kind of mentioned this earlier, but I think the prevention efforts
Yeah.
are very important. Just kind of bringing that conversation in from such a young age. I just think the fundings in itself for the government, it's pretty minimal, and I just think there should be more curriculums, and just I think there's like improvements like WeClass, for example, that was mentioned. I think those are very big changes, and I think we've come really far, but also it's not really as effective as a lot of people hope it to be, and I think a lot of it also lies from the lack of like conversations that are in general incorporated into students' lives from such a young age. So I really hope to see that happen where, for example, I think an example of like prevention methods could be like peer-to-peer mentorship, where it's, I've seen this in like substance use populations and so on, where it's like people campaigning for like not using, for example, and I think a lot of the mental health and conversations lie from what your peer says, like the stereotypes, and just kind of making it a comfortable environment for you to actually speak up about mental health where it's such a stigmatized issue. I think having like a peer program, for example, in schools and curriculums, where I've definitely seen this happen in other places as well, would be, I think, a really monumental change for Korea, where we're allowing students to talk about mental health in a not so serious way, and it's also just kind of a part of life. And I think if you're doing that from like kindergarten, elementary school, middle school, I think it's just making it a lot more of a open environment where you're able to be vulnerable, which I think is very minimal in Korea, in the culture itself.
Many schools, including some schools in Korea, have started to make dedicated classes on social and emotional learning or mental health, kind of part of the curriculum. Is that something you've seen, or if it's not, is that something you think is a helpful part of the kind of solution, that students are required to sit down and have their teachers talk to them about mental health issues? Not one-to-one, but the whole homeroom or a whole school at a time.
Yeah, I do. I have experienced in my school. I think we have those curriculums regularly, about once a month. And for my school, it's through this big screen.
Yeah.
Yeah, teacher doesn't come to our class. It's just, we have that.
The whole school sits and watches a big screen.
Yeah.
Yeah.
There is a broadcasting room, and a specialist comes in and talks about the mental health issues, and we watch it through the screen.
Yeah.
Yeah. So, in my opinion, it doesn't really work well, and it's just a video. So, what would be so effective?
Yeah. So it sounds like you're describing a very passive process where the school's not.
Yeah.
I do think that the government is aware of the mental health issues that is ongoing on Korean schools. So they are trying to do some things like playing videos, but I feel like that teachers are not just so interested in such things because my school had that own curriculum like 1 or 2 times in a month, but my teacher just mute the screen so that we can study.
So that's sending a very clear signal that they don't care. That's okay.
It happens very often in original schools in Korea because teachers think that good grades are better than mental health.
Okay.
It's not a real priority of like students. Like teachers just believe that you can deal with it after you got into college and you need to just study for now, something like that.
In a conversation with Una before I arrived here, he talked about how there are some suicide prevention discussions, but again, they feel very, the way he described it as someone tells you that life is important, and that's kind of it. Is that, it's not active, it's not engaging, it's pretty passive, pretty check a box. Is that how people feel? Yeah.
I think also it comes from they don't really know how to talk.
Yeah.
To.
Yeah.
I think they just.
Who's they in this? This is like an outside
yeah.
person or one of your teachers?
I think in general, like a lot of adults, or honestly just kind of anyone who hasn't really experienced it, I think a lot of them are struggling to kind of form the words, or I don't think they really know how to talk to someone like who are experiencing that or struggling with mental health or suicide ideation. I think also the words like that are used, for example, like that are related to suicide are considered pretty harsh, or kind of something that sounds kind of scary.
So people don't talk about it.
Yeah. So I think it's just a lot of them really don't know how to talk about it. Yeah.
I mean, it's a theme that emerges from when you see a bunch of different countries. In talking about prevention, for mental health generally rather than suicide specifically, that it's very easy for the government to say, okay, all teachers must do 5 times a year or 12 times a year, they must teach students, but if you don't give teachers the tools and the training, if you've trained as a maths teacher, you're not a mental health professional, you don't know about what studies say about how to, it's been a long time since you've been an adolescent. So I think helping teachers to know how to do that, it's a complicated subject and it requires training, it's not something you can be an amateur in. Sure. That's a big part of it, rather than just say, okay, great, you go do it and then it'll be fine. Yeah.
For sure.
Interesting. Well, okay, so we've talked about things the schools could do. Clearly a bad answer would be just put more stuff on the curriculum, because that's not gonna, none of you are sounding enthusiastic that's part of the solution. What other ideas would you, we've had a great suggestion for mental health sort of sickness days, we've talked about prevention a bit. Are there other ideas that come to mind?
I'm just thinking.
Oh yeah. Well, why do you think maybe try and move on to sort of related questions, which is obviously we're sat here, it's election day. And I understand that it's not been a major issue on the campaign of talking about young people's mental health, but maybe sort of slightly pose a cheeky question. If one of you were appointed Minister of Education in the new government, so I've been asking you what you think a school principal should do or a school teacher should do, but if you were sat in in the Blue House, or you were sat in government, what would you like to kind of drive from like the central government to kind of promote this, whether in schools or in the healthcare system or elsewhere? Are there kind of wider political and government changes you think might be helpful?
Recently, the policymakers made policies like covering hospital or inpatient treatment costs after a suicide attempt, but rather than that, I hope to see more policies that focus on early intervention and prevention for youth mental health. That's more important because after the accident, we can't turn it over, so we have to place more in prevention.
What are some prevention things, initiatives, programs that you'd like the government to pursue?
Like education for teachers and parents.
Yeah.
and students, and it should be very meaningful because these days the education for mental health is very meaningless and students just sleep or just that's but they are really related to the mental health but they don't know it.
It's a great idea. I mean that's I guess goes exactly to what we were just talking about, which is teachers don't know how to lead these sessions in schools. Other thoughts?
So in Korea, till our last era of high school, we have this regular health check. Health check happening in schools. So, however, there isn't any mental health check in the checkbox. So maybe it would be helpful for us to include mental health as a feature in the health check list, because even though it does not directly help the students, it will efficiently enhance our perspectives on mental health as a society level. So I think
That's a really good suggestion.
Honestly, I have been putting some thought into this, but I think I think a really important issue that not a lot of people talk about is I don't think a lot of Korean people know how to like relieve their stress. Like they don't really know how to take care of themselves even if they're trying to. And I think a lot of the efforts lie on, oh, do you have a mental issue or not? And if you do, like what do you do kind of situation. And I think this also connects to prevention where it's, I think, like for example, like physical education in Korea, it's a lot different than how it is done in other countries.
What do you mean by that?
I think it's just kind of considered as like a passing, I would say, subject
Right. Okay.
where, and also like being an athlete, for example, it's a very serious path that people take. It's not like a side thing that you can do while doing a student.
So there's even more stress
Yeah.
and there's even more expectation.
So if you want to do like sports, you have to go to like a sports school, and that's like your path now. You can't do anything else. And so I think the incorporation of like other health, like hobbies, for example, even if it's not sports, like incorporating the healthy habits is really minimal, I would say, in Korea. And like so many people, like you've like heard multiple times, like people spend hours and days just studying, and it's just they don't really know what to do with their time. And I've experienced it myself as well. It's like you kind of give up a lot of things to do studying and to get to reach your goal, which is college. Not a lot of people don't know what to do afterwards, and a lot of them consider it free when they go to college and they start drinking and kind of having that freedom. And a lot of people I don't think know how to handle their free time. And I think that's why also like cell phones and like social media and those things also line into more isolation and such. So I think that personally, if I reach to like the Ministry of Education and such, making big changes in what like sports, other non-academic subjects, putting more emphasis on that, making that possible even while you're studying, and putting emphasis more on that even when you are putting that much time and effort into studying, I think also is a very important change that not a lot of Korean schools have. So
adding on to that, currently on our 9th grade, PE, visual arts and music are excluded from our actual subjects in order to study more, in order to build more knowledges on in other subjects, for example Korean, English and so on. So those efforts, I definitely agree with that.
And I think in high school it's like cancelled once you reach that point where you're like really close to like the exam. It's like, oh, we're skipping it this time.
Some
like,
more time for studying.
So I think that also is like seen sometimes.
When, as I'm sure you all know, all the academic evidence shows, physical. Also, purely for like an academic point of view, it improves your attainment. That's really interesting.